Hello, I'm Paul Beckwith. Thomas Poyo has written a second brilliant article called Coronavirus, the Hammer, and the Dance. Okay, it is absolutely vital that to fight the coronavirus, countries take extremely aggressive measures as soon as possible to break the exponential growth curve of the coronavirus cases so that hospitals in those countries do not get overwhelmed. So the idea is hit it very, very hard as quickly as possible with a big hammer, and then once you reduce the R value, the spreading value, which R times zero, R zero is say about 2.4, 2.5, you need to lower that quickly below 1. Then the cases peak and drop off. And then once you've got the R value less than 1, you can start opening up your economy and you play a delicate dance. You keep the R value less than 1, don't get it. If it goes above 1 and cases start growing, then you shut parts of the economy, bring it below 1, and you do that for a while, and that gives the population in your country time to build up some immunity. So this is vital information. I'm talking to you in the US, I'm talking to you in Canada, I'm talking about wherever you are in the world. This is what we need to do. We need to crush the virus. We need to hit it hard with a hammer, get the R value to less than 1 so the virus doesn't exponentially grow, and then play a delicate sort of balancing act to get the economy started and going at some sort of level and keep the virus at bay. So let me get right into the details of this video, of this paper. So just Google the title here. I can't recommend more highly that you read this and share it and send it to politicians and decision makers and make sure they understand the concept. It's the best paper that I have seen on this. So this is the do nothing curve, unmitigated exponential growth, overwhelming hospital systems, bringing death rates to well over 5%, maybe between 5 and 10%, as high as 10%. If you start doing half-assed mitigation measures, you can slow this exponential growth, but it's still exponential. So what you have to do is you have to apply a hammer so that you reach a peak and then you drop off. This time period is 3 to 7 weeks, according to the model. Okay, it could be as short as 3 weeks, and then you can start getting your economy going. And the dance is an ongoing way to deal with it so that the rest of your so that the population that doesn't get infected builds up some sort of immunity. And it buys you time for vaccines, etc. Now the key thing is when you apply the hammer, you don't see a change initially. The growth is still very, very high. It can take a couple weeks lag time before you get the peak. So you have to apply the hammer, shut down your economy, but essentially, except for a few grocery stores and essentials, until you get a peak and a drop off. You maintain things until you get a strong drop off, and then you can start up your economy. And this is not an indefinite period of time. This is 3 to 7 weeks. So the crucial thing is you apply the hammer, and there's a lag of a couple of weeks when you just have to wait. And this is the tough period. This is a period where Trump's already talking about, restarting economy, et cetera, which is totally would be a total mistake and would cost literally millions of lives of people in the US. Okay, now the author previously wrote Coronavirus, Why You Must Act Now, and there were 40 million views and 30 translations. Okay, so here's what we have to do, countries have to do. We need to take strong measures today, right now. They should only last a few weeks, 3 to 7 weeks. There shouldn't be a big peak of infections afterwards, and it can all be done with a reasonable cost to society, saving millions of lives along the way. If we don't take these measures, tens of millions will be infected, many will die along with anybody else that requires intensive care because there won't be a healthcare system it will have collapsed. It won't be able to save all the people that would normally be in intensive care for reasons unrelated to the virus. So within about a week, countries have gone from this coronavirus thing is not a big deal to declaring the state of emergency. Yet many countries are still not doing much. Why? Every country is asking the same question. How should we respond? The answer is not obvious. So some countries like France, Spain, or Philippines have since ordered heavy lockdowns. The US, UK, Switzerland, or Netherlands, they've dragged their feet, hesitantly venturing into social distancing measures. Okay, so the questions are, what's happening now? What options do we have? What's the one thing that matters now is time. What does a good strategy look like? How should we think about economic and social impacts? Okay, so the points that are happening here are already, our healthcare system's already collapsing. Countries can fight it hard now. They hit it with a hammer, or they will suffer a massive, uncontrollable epidemic. The time to make between these two options is now. We have to decide these things immediately. If we choose the epidemic, hundreds of thousands will die, in some countries millions, like the US. And that might not even eliminate further waves of infections. If we fight hard now, apply the huge hammer, we can curb the deaths, relieve the healthcare system, allow us to prepare better, buy time to learn. The world has never learned as fast about anything ever, and we need it because we know so little about this virus. All of this will achieve something critical: buy us time. If we choose to fight hard, the fight will be sudden, then gradual. 3 to 7 weeks. We'll be locked in for weeks, 3 to 7 weeks, not months. Then we'll get more and more freedoms back. It might not be back to normal immediately, but it will be close and everything back to normal. Okay, so here's the situation. Okay, so in the original article, these are the cases excluding China on March 4th. So we had South Korea, Italy, Iran, and then zooming into these countries here, you can see these countries here. This is the previous graph, and this is what's happened since then. Okay, okay, so you can see the tremendous growth. This was in the previous graph, and this is what's happened. Italy taking off, Iran, Spain on its heels, all of these countries lagging behind Italy, but all showing this exponential growth. Okay, so Spain, Germany, France, and the US all have more cases than Italy when Italy ordered the lockdown. So unless they act urgently, they will become worse than Italy. Okay, and there's many other countries involved. But all of these countries are, outside of China and Iran, the countries that have suffered massive, undeniable outbreaks. Every single country on the list basically is among the wealthiest in the world. Okay? It's unlikely that poorer countries aren't touched. Warm and humid weather probably helps, maybe lowering the R value a bit, but it doesn't prevent an outbreak by itself. Otherwise, Singapore, Malaysia, or Brazil wouldn't be suffering outbreaks. It's taking longer to reach these countries because they're less connected. Okay, but most countries won't escape it. It's a matter of time before they see outbreaks and need to take measures, and hopefully they can learn what we're doing. So, measures in Spain and France. Okay, and you can see the timelines and so on. Basically on March 12th, for Spain, March 12th, President dismissed suggestions that the Spanish authorities had been underestimating the health threat. On Friday, that's on Thursday, the next day they declared a state of emergency, and then they took measures to people can't leave home except for groceries, work, pharmacy, hospital, bank, or insurance company. Extreme justification. Specific ban on taking kids out for a walk, seeing friends and family, etc. All bars and restaurants closed, all entertainment closed, no guests at weddings, handful of people at funerals, keeping mass transit open, and then they shut the land borders on Monday. This stuff is happening extremely quickly. I call it coronavirus time. It's like a time compression. A month ago in the world seems like a year ago to me, probably to a lot of other people too. Everything's happening so quickly. The US and UK have dragged their feet. You know, March 11th, travel ban in the US, national emergency a few days later, no social distancing. Monday, the government urged the public to avoid restaurants or bars. No social distancing enforceable. It's a suggestion, but lots of states and cities are taking their own initiative and actions. Similar in the UK. So here's the options. Option one is do nothing. Let's see what happens if a country like the US does nothing. So here's the infected cases building up, and this is the total dead. And you get 10 or 11 million people dying in the US. At the peak, you get 13.9 million hospitalizations. And this is there's an epidemic calculator where you can calculate these things, and I'll show you, if you just Google epidemic calculator, GabGo GitHub epidemic calculator, you can get this and you can play around with all these numbers yourself. But this is what the hard facts are for the US. Doing nothing, or 11 million or so dead, more than 10 million dead in the country. And look at the time frame. This is only 6 months from day 0 to that number, 6-7 months. Boom, it's all over. Okay, so if we do nothing, everybody gets infected, healthcare system gets overwhelmed, mortality explodes, 10 million people plus die. If 75% of Americans get infected, 4% die. 4% would be a conservative rate with no hospitals functioning. That's 10 million deaths, or around 25 times the number of U.S. deaths in World War II. This is a harsh reality for the U.S. So what share of people will catch the virus? What share of them will die? If only 25% are sick because the others have the virus but don't have symptoms, so aren't counted as cases, and the fatality rate was 0.6% instead of 4%, you end up with 500,000 deaths in the U.S. The only way to keep the fatality rate down in these sort of numbers is to keep the hospital functioning. Okay, so here's if you look at hospitalized people instead of infected and dead. These are all the hospitalized patients, peaking at over 12 million. These are the ICU patients, which is a fraction, 20% of the total numbers here. And this is the capacity of the healthcare system. So in this case, you completely overwhelm the hospital system. And lots of the people, those 5% of the critical people that get critically sick from the coronavirus, they don't have a chance in the hospital. But the problem is it talks about ventilators in the U.S., and this is why people died in droves in Hubei province, Wuhan, and this is why they're dying in droves in Italy and Iran. They've overwhelmed the hospital system. Okay, so that makes the fatality rate at least 4%. If 5% of your cases require intensive care and you can't provide it, most of those people die. It's as simple as that. But that's not all. There's collateral damage. What happens if all your healthcare system collapses by coronavirus patients? Then if you have a heart attack, for example, but the ambulance takes 50 minutes to come instead of 8 because there's too many coronavirus cases, once you arrive, there's no ICU and no doctor available, well, you're going to die, right? So there's 4 million admissions to the ICU, intensive care unit, in the U.S. each year, and 500,000, 1 in 8 of them die. But without ICU beds, that share would go closer to, instead of being 1 in 8 or 12.5%, that number would go up to 80%. Even if only 50% died in a year-long epidemic, you'd go from the 500,000 deaths a year to 2 million. So you're adding 1.5 million deaths just with collateral damage. That's a 50% number. It's probably going to be close to 80%. So it's more like 2 or 3 million deaths, collateral damage. So if the U.S. healthcare system collapses, which it will if the coronavirus is left to spread, the deaths will be in the millions, maybe more than 10 million. This is true in all countries, okay? That where healthcare systems collapse, it means mass death. Okay, so we have no choice but to act. We have absolutely no choice but to act. And so the other option 1, do nothing, not possible. Option 2 is a mitigation strategy. And I'll continue this in another video. Thanks for listening.